Okay, so, and you can start letting in the other folks. Okay. Good afternoon and welcome to the Insurance and Pharmaceuticals Subcommittee of the Health and Government Operations Committee, Part 2 for today. And we know we have quite a group here and regarding Senate Bill 3, which is the cross-file of House Bill 123, Preserve Telehealth Access Act of 2021. Do we have everyone in from the waiting room?
Yes, everyone that is waiting.
Okay, super. So let me talk a little bit about the process that we're going to follow and how we came to the reprint that you have here before you. Senate Bill 3 came to the House with a couple of differences, significant differences from House Bill 123. Lisa Simpson and I met with a lot of advocates over last week, and we met with Senator Augustine, the sponsor of, no, it wasn't the sponsor, Senator Griffith is the sponsor, but he was like the committee leader on the Finance Committee on this bill. And we were looking for paths forward in how we could meet multiple needs and come together that we thought enabled us to be comfortable with the bill and all together. And we believe this morning we did just that. We think that we have a bill that does what we came out of, what the approach that we took from the House, which was to create a bill that gave us the opportunity to study the utilization and the impact of telehealth over the next couple of years. And the Senate took the approach that this bill had more, required more around the issues of network adequacy and patient choice than we had included in our bill. In meeting with the MIA particularly, there were some concerns around some of the language in the Senate bill, because what the struggle was that there's a process going on right now to develop the regulations around network adequacy. And what the MIA said to me, and I think some of them may be here, that the current statutes around the current regulations around network adequacy were not working. And so the process that it's been going through with advocates over the last couple of years is to develop regulations that would work. And they were afraid that the language that came to us from the Senate bill would keep us in the status quo, which was the process that was not working. So that's the background for some of the changes that you'll see in this bill. And what Lisa is going to do now is go through the differences in what's different from Senate Bill 3 as the result of those discussions. So Lisa, you want to take it from here?
Okay, so what I'm going to go through is what is different from the last time this group met and was talking on about House Bill 123. So these are differences that are in the Senate bill as it is before the subcommittee now. The first change is on page 10 of your packet, which is page 4, line 22 of the bill. And that is retaining current law, the current law that the Medicaid provisions are subject to the limitations of the state budget. There are additional changes on pages 15 and 18 of the packet. And these are addressing an issue that MIA raised, that carriers did not direct care or care options. And then a change was made to the Medicaid provision for consistency The change strikes language that would have prohibited Medicaid or a carrier from requiring a recipient of the program or an insured patient to use telehealth in lieu of in-person service delivery, and instead prohibits the exclusion from coverage or denial of coverage for a behavioral health service when provided in person, solely because the service may also be provided through a covered telehealth benefit. Also on page 18 of the packet in lines 3 through 5 of the bill, page 12, there is language that requires that the coverage for telehealth service, that requires the coverage for telehealth services regardless of the location of the patient. On page 21 of the packet, there is language requiring MDH to revise regulations regarding health reimbursed by Medicaid to be consistent with federal parity requirements by October 1st, 2021. And also page 21 of the packet, after line 15, there is language that is added that specifically requires MIA to study network adequacy and patient choice and requires MIA to consider the requirements of the bill when proposing revisions to the network adequacy regulations.
Okay. So we have a number of people here. As I alluded to in the beginning, this product is the result of a lot of discussion among advocates and the senator and our support folks, Lisa and Patrick. And where we left each other this morning was that these were things that we thought was a good bill and could move us forward. So I'm happy to let people briefly make a comment if you need to make a comment. And I'm especially interested in questions from the committee. But I'm hoping that we can help move this bill forward because it's a really important bill and we've got to get it on a voting list. So with that, I'm kind of opening the floor and I'd ask you to use the participant function to raise your hands if you have a comment that you'd like to make. Let's see here. Here we go. Okay, Delegate Krebs.
And Madam Chair, I thought our bill was really good, and this is a lot of huge changes. Did they take any of the things from our bill? And I might have missed that. Did they incorporate it into their bill, or is it just additional thing?
Actually, what happened was they added things that we then, some of which we took out to conform it with our bill. So
they started with our bill and then added things to that.
Correct.
Okay, I've got to go back. I mean, it's a lot. Yeah. Just trying to figure out what the starting point was. Thank you.
So the starting bill was our bill.
Okay.
And they made several additions. And one of the additions was to it would have impacted the development of the regulations around network adequacy. And so we took part out. They, on the part where it was directed about that, where the carrier could not require a telehealth visit over a in-person visit, we had left that with behavioral health services. They took behavioral health services out. We were very concerned. I got a lot of feedback on that because what it would do is actually limit consumer options ultimately. So we left it with the senator and I discussed it, and he was comfortable putting the behavioral health back in so that that part of the bill was limited to that. The other changes, and then the important other change is to make sure that MIA. So when MIA took this on, and I have to be very appreciative of them, to study the impact on network adequacy and on patient choice. And so that's above and beyond the study that MHCC is doing. So those are the major changes in the bill. that you see here in front of you.
Were they in other bills, or were they just things that came up that were hanging out there? Or were they parts of other bills that came forward?
Part of what was the Senate added was in another bill, was another bill that Senator Augustine, it was the cross-file Delegate Bagnell's bill on telehealth with respect to behavioral health services.
Okay, all right.
Okay.
Thank you.
Okay. Any other questions or need to make a statement? Absolute need to make a statement. I'm not seeing anyone. I see no hands. Is there anyone who would like to move the amendments to the bill?
The amendments.
Amendments are
Second.
moved. Do I have a second? I hear a second. Any discussion on the bill? Okay. Seeing no one, those in favor, please say aye. Anyone opposed, please raise your hand in the participant panel.
Move the bill.
Okay, yes.
Second.
Moved, and the amendments passed unanimously. The bill's been moved. I have a second. Do I have a second?
Second.
Okay, thank you. Bill's been moved and seconded. Is there any discussion on the bill as amended? Okay. Seeing none, those in favor of the bill as amended, please say aye. Those opposed, please raise your hand in the participant panel. Not seeing any hands, the bill passes unanimously. Thank you all very much. Thanks for your patience and for coming back. And for the, really, I met with many of you over the weekend of the advocates. And so I appreciate your time and efforts to get us to this place. So thank you all very much. And the floor session begins at 4 today. With that, we will be meeting again at least once. So please watch the schedule so that we'll know when we're coming back together. Okay, thank you all. Have a good afternoon.